Hello, good evening. How are you? How are you day? Welcome to another session of Ask the Doctors. I see you. Where are you to watch me from? Where are you watching me from? My name is Frederick Unwibohai, and I'm privileged to be the host of this program tonight. Today, we are doing question and answer session. So, in case you have any question for me today on the program, just Just be rest assured that we're going to answer you today. But before we go ahead, I want you to tell me, where are you watching me from? Oh yeah, let's go. Where are you watching me from? Everybody, oh yeah, put in the comment section. Where are you watching me from? Chukuka Emmanuel, good evening. We are streaming live on Facebook. We are streaming live on YouTube. We're also streaming live on Instagram. Where are you watching me from? Oh yeah, talk to me. Good evening. Happiness, I see you. Lamin from Mozambique. Victoria from Sierra Leone. Billy Kiss, good evening. Essay from UK. Okay, we have people on YouTube as well. Abdul Ganiyu, Stidi, how you day? I'm watching from Abuja. I'm watching from Germany. Okay. Una plenty. Oh, shit, let's go. Let's go. Now, if you are watching this video after we have ended, sorry, I might not be able to respond to you because I noticed that after our live session, some people usually watch this video and they begin to ask me questions, and we are no longer live. So if you're watching me after we have ended, sorry, I might not be able to respond to you. Welcome, everybody. Good evening from Kaduna. Nasara Victor, I see you. Betty from Belgium, from Ikeja GRA. Okay. I'm your host on this program. So let me tell you briefly about this program. Ladies and gentlemen, please listen carefully. I beg, be careful. There are fake pages on Facebook that are pretending to be me. These pages are not real, so that you don't fall prey to them. This is my real page. As long as you can see me, you are on the real page. Here, look at the name. Please be careful. Look at the real handle of my page. This program has been on for about 4 years. So every Sunday for the past 4 years, we are live every Sunday. Youngest Slim from Ogun State, who again is watching me. I see you, those on Instagram. How far? How far? How far? Okay, so you're welcome tonight. Now, if you have any question for me, watching from Lagos, happy Sunday. I'm watching from Benue State. Una plenty. Okay. Joy Arenze, Paul Tekembi from Benue, I see you. Humble Desmond Enugu, Victory from Banjul, Blanche Tenjin from United States, Cara Aguero from Lagos, Ijoma, I see you. Okay, now if you have questions for me tonight, please drop your questions in the comment section and I will try my best to respond. Cecilia, good evening. How are you there? Welcome everybody. Welcome everybody. How have you been? How your family? Happy Sunday. Happy new month to you. God bless you. So I beg and take notes of this page. No go fall for somebody, make them chop your money on the internet. Here, I'm in. Okay. So if you get questions for me, Laurencia, how are you? I have a question. Please, what can one do to maintain sugar level as per diabetic person? Okay, may I answer you, Mr. Silva? Your question are two the inside. If the person is diabetic, if the person get diabetes, I believe say the person get doctor with the treat am. Do you understand? Because we know they fit treat people on social media. Social media not only to advise you, we know they treat. But what can you do for somebody who never get diabetes? Exercise, watch your weight, eat healthy, avoid junk food, eat fruits and vegetable, avoid sugary drinks. Now, if you get diabetes, your doctor will advise you exercise, very important. Your doctor will also advise you, may you eat healthy. May you reduce the amount of carbohydrates, eat protein. More, it will help you. But carbohydrate is important to exercise. Then you monitor your blood sugar, avoid sugary drinks, avoid fatty foods, all those processed food, avoid them. Monitor your blood sugar. Your blood sugar should be controlled. If you dey hear me, share this live session, everybody. Oh yeah, share the live session. Let's go. Share the live session. Let's go. Okay. I have a question here. My daughter is 2 years and has not started working. What could be the cause? Happiness. Have you taken your daughter to see a pediatrician? May they examine your pikin? There is no way I fit tell you wetin dey do your pikin online. If your daughter never work out for 2 years, it might be that she's fine, but she's having delayed developmental milestone or something else. So waiting, we go tell you now, somebody needs to examine your daughter to be sure that everything is okay. And if there is any problem, they will come tell you. But there is absolutely no way we go fit tell you wetin dey happen to your daughter online. Yes. Okay. Now, let me say something before I continue. For those who dey watch me for the first time, we know dey treat online. Abeg, I know they give medicines on social media. So in case you are watching me and you are hoping that I go treat you, I go prescribe medicine for you, I'm sorry. I know they do that kind of thing for here. We know they do them. So we go advise you, make you always go to the hospital and see your doctor. This place now only to teach, advice, not to treat anybody. My co-host is in the house. Dr. Israel, if you can hear me and you are ready, do like this. Okay, you're ready. Okay, let me bring up my co-host, Dr. Israel. Dr. Israel, your mic is muted. Good evening. How are you there?
Good evening. How are we there today? Happy Sunday.
Yes. We're good. Welcome. So, for those who they see us for the first time, you did welcome. Now, let's take questions and let's try to be fast. We get plenty questions today. Dr. Israel, somebody asked us questions. They say, I have a question. How can one or what can one do to stop yeast infection? Any good drugs?
Okay, first thing, it's not about drugs. First, not to talk about your hygiene. So, what they make yeast they grow, and yeast is candida. So, what they make and grow? They quick grow for moist environment, place where they moist, where not dry, a dampy environment. So, if the environment when you dey or when they always wet and they dampy, and they make yeast they grow well. And also for women, mostly because now women they quick get, and the way when they take they wash their self, and after they don't urinate and all that, fisting maker they come out well. So you first of all need to first address those issues, so that because if you don't address those issues, no matter the number of drug when you take, if you treat and finish today, tomorrow it go still come out. If you treat and finish, the next day it go still come out. But when you don't address those issues, when you don't know how to take care of your body, make your body the day dry, then we're not going to think about whether yeast they grow or yeast not they grow. And sometimes most of the things when women they say when they say that yeast infection, maybe normal natural mucus where women they see for body, or when they see and you're saying something and they happen to them. So first thing first is that your underwear, if you not get where you they go, if you dey as you not get where they go, there's no need wearing anything under. Just allow breeze to enter your body. And two, when your underwear when you dey wear, it should be cotton. When you say you go feed dry up whatever, if heat day, you go feed dry and up. And another thing, when you go urinate, when you don't go piss, at least you when you piss finish, for some ladies they use water. Once you use water, try dry yourself well so that makes small water not still remain for there. And another thing is that when you want wash, those some ladies will want wash inside. I don't know what they go find for inside. And sometimes those ones see they help, they cause all this infection to they come and come and come. So what you need to do, you don't need to wash inside, go to chook out for inside. No, just wash the surface, the outside, and that's all you need to do. So another thing is that your underwear, if you need to sun dry them, or better still, you change them. And that's the best. We say you change them. If you don't treat those kind of things, you change your underwears. But because we know the kind of place where we'll be for those, because we know the kind of place where we be, you not fit change your underwears because of financial things or one thing or the other. You need to wash them very well. You sun dry them. When we say sun dry them, it means you dry them for sun. And for some case, if maybe you never fit dry them for sun, because some people they fear to go dry something for sun, before you wear them, you iron them. You iron them very well, and so that make it dry and the hotness and all that, and before you use them again. And treatment of any infection, for more forget yeast now, any infection, both the yeast and all of them, not be one person that they treat. Not be one person that they treat. If you get partner, you also need your partners to be treated. Because if you treat yourself finish and your partner still gets the infection for body, and when I still meet, your partner go see transfer and back to you. So you also need your partner to be treated. So that when you don't treat yourself and your partner don't treat themselves and you don't take care of all this hygiene aspect of it, I tell you, you go there okay. So if you dey think of medication, sorry, for this our platform, we know they give medication. The best thing when I go fit tell you, apart from all this advice when I don't give you, now for you to go talk to your doctor, go hospital, talk to your doctor. Your doctor is the best person to do investigations for you, then give you any medicine when you know say it will work for you. Thank you.
Okay, thank you, Dr. Israel. We'll try to fast with the questions. We get question on Instagram. We did live on Facebook. We did live on YouTube. We did live on Instagram. It's Sholi Z on Instagram. Say, is it possible to have 2 lines for pregnancy and later, after 4 days, the line didn't show again? Surely on Instagram they ask us this question, Dr. Israel. Oh yeah.
Okay, when you see 2 lines for pregnancy for tests when you by yourself do, and most of the time we know this one only accept the test when you do. Once you have seen it, the next thing when you're supposed to do now to go hospital, make they really confirm whether not true, and so that they can use blood to do the pregnancy test. And the best way to even confirm finally now to do scan. So when the scan, you do scan and they can't see for inside, it means say it did it. So if you do a test with urine and you first see 2 lines, the next time you can't do and you not see 2 lines, and sister, go hospital. Go hospital, make them agree in examine you well, then do scan for you. If you are really pregnant, you go see am for there. So that now what I go talk for that.
Yes, thank you. Everybody when they hear us, oh yeah, share this live. Everybody on YouTube, on Facebook, on Instagram, click on the share button. Let's go, share. Okay, we get plenty questions, Dr. Israel, plenty questions. This person says, what are the recommended drugs or injections for hepatitis B?
Okay, as we earlier said from the I don't know if Dr. Fred talk before you see this question, because I know every sure say supposed to talk this question at all. We not they prescribe or we not they tell anybody any medication for this platform. When you see ask the doctor when they do every Sunday, when we they do every Sunday by 8 p.m. Once you just see them, just clean drug for your mind, because we will not prescribe or tell you any medication. We are not here to say anything. We are not here to prescribe any medication for you. Maybe you can't go one chemist or one pharmacy, go they waste your money. No, we are only here to educate you. So my brother or my sister, when you ask that question, sorry. If you want to know any best injection or best drug for hepatitis B, go to the hospital. See an internal medicine doctor, a gastroenterologist. Now then go prescribe the medicine or drug for you. However, if you never do test for hepatitis B, or you never know your hepatitis B status, this is an assay opportunity to let you know, say you suppose go test yourself to know your hepatitis B status. And if you be hepatitis B negative, that is very wonderful. Vaccine dey, go take the vaccine so that you no go dey fear or ask many things about hepatitis B drug or hepatitis B injection. Thank you.
Thank you so much, Dr. Israel. We get plenty questions. Okay, let's take this question here. He says, I have a question. My mother-in-law has stroke and she's here with us. She's on wheelchair. Just wanted to know if there is any possibility for her to walk again.
Yes, there's possibility for her to walk again. The only possibility for her to walk again is if you guys, if you dey do physiotherapy for her very well. And so having stroke now one thing. Now the treatment of stroke now if they take medication well and if they do physiotherapy. That physiotherapy now go make that in the wherever the stroke affects, then go make am come back to life, walk again as he suppose. Some people feel recover 100% to the extent say you no go even know say they first get stroke. While some people may not recover 100%, but yes, they go fit still dey waka small again. So if you never start physiotherapy for your mother-in-law, it go dey good make you start physiotherapy for am. The physiotherapy na small before you know, you go see say she go come dey do well. So that na the best way to make her take waka again.
Make I add something as well. Now, the time between the stroke and when una start treatment, they very important. If your mother-in-law gets stroke and una leave her for house for a long time, and the area of the brain where it affects, it don't come affect them so bad, it go dey difficult for the person to get the body back. So when stroke happens, the treatment where you give and the time you start the treatment, they're very important. You understand? So if na recent stroke, quickly run. If una don't see doctor, they don't manage her, we will advise you continue follow the advice. Some people can be very lucky and they can get back their function. Okay, doctor, when is the best time to take in after cesarean section?
Okay, after cesarean section, we dey always advise say it go dey better after 2 years. You fit take in again. After 2 years, you fit take in again. This one na to make sure say the uterus, the womb, when the pikin dey stay, it don't well. Where they cut, don't heal well. So within 2 years, 2 to 3 years, you fit take in again. And another reason is because so that if you want come, if now your first, I think the year what I talk, if now your first cesarean session, your first CS, your doctor feel one try to see whether you go feel born by yourself, because you waited for a longer time for at least 2 to 3 years. But if not be your first, sorry, they're not going to do all those try. So, but in the next 2 years, yes, you can become pregnant again.
Thank you, Dr. Israel. I beg, share this live session. Share. Somebody sent me stars. Clara, Madam Clara, I saw the stars you sent. God bless you. Thank you very much. Clara Osabuen. Okay, thank you so much. And God bless you for the stars. Thank you. Okay, we have a question here. Is it true that antibiotics can't cure staphylococcus completely unless you use NAFDAC approved herbal medicine?
Okay, the first thing when you suppose know is that staphylococcus, and I know say many people don't really abuse. In fact, if staphylococcus himself, if staphylococcus species himself go fit talk, he go don't tire, he go don't talk saying don't tire for most of us for this country. And most places when we they listen to what they talk, they go don't tire for us because staphylococcus now one bacteria where they everywhere. Even your skin is there. So you not really need anything to the key waiting. They are like normal
Okay.
flora to us, except maybe they can enter place where they're not supposed to. Now you feel on they think of treating them. So most of the time, most places where they say staphylococcus, it just be say either you not do the test well or most of the time na that place when you dey for see and now there is supposed to. So they just want collect money from your hand. So you don't really need any NAFDAC approve whatever to take key all the normal flora when they, because once you do that, you dey also expose yourself to other bacteria and viruses to affect you. So because this normal flora when they our body, they help us as well. They help us. So make we not look for make we not use our hand, they find trouble for our body. I beg, leave staphylococcus alone.
Thank you, Dr. Israel. Evie Sandra, thank you for the stars where you send. Evie Sandra, I see your stars. Madam Clara, thank you very much. Before I continue, I beg, share this live session. Again, I want to give this announcement. Ladies and gentlemen, be careful. Then get fake pages on Facebook where they pretend to be me. There are some fake pages on Facebook that have opened with my profile picture and they are posting my videos. Please be very careful. Look at the name of this page so that may they not go chop you. Now beg at the beg. Yeah? Thank you very much. Okay, Dr. Israel, we get plenty questions. Let's go up again. This person says, what are the type of food to eat with fibroid?
The type of food to eat with fibroid. I don't think there's one type of food you should not eat because you get fibroid. I think any food when you think you can eat, you should eat it. I don't think there's any food you say you not go eat because you get fibroid. So eat your normal
Yeah.
diet, vegetable, and eat your normal diet. You can only reduce folic acid and all that. If you did one before, you can reduce it until when after you don't do this. If not to do the operation, after you don't do the operation, they don't go test them for histology, and then you can now take those. But eat your normal diet, you not get any problem.
Yeah, thank you, Dr. Israel. But make I add also. Okay, wait, before I continue, we did live on Instagram, we did live on Facebook, we did live on YouTube. Wherever you do watch us from, you did welcome. Folic acid no they increase fibroid though, because I don't see that thing. People go tell you say, make them not take folic acid because it go make the fibroid grow. Honestly, it won't. So that because a lot of women have been saying that. Dr. Israel, did you hear me?
Yeah. Not be because of the fibroid I talk. If you my word, I said so that when they don't test them, eh? When they don't test and they can say okay, it's normal fibroid, so there is no problem. Because sometimes all those swelling can be something else. Now make me talk.
Yes.
So it's not like
Okay,
folic
good,
acid
good.
get anything to do with
Thank you.
fibroid.
Yes, yes.
Yeah.
Too much. Okay. Thank you. Somebody sent me stars again. Mirabel Jacobson. Mirabel Jacobson on Facebook. Thank you so much for the stars. God bless you. Okay, let's continue. We have so many questions. Please, what are the signs of 5-year family planning? I don't understand this question. Also, Israel, do you?
No, I don't understand it. 5 years
Okay,
family planning. I don't understand. So I beg
okay.
try modify your question.
Yes, yes. The questions we get today are up to 100. So I'm taking them as they come. I beg, just relax. Eh? Okay, let me see. Doctor, good evening. Please, can a pregnant woman still see her period? The answer.
When you don't get belle, you're not supposed to see your period. So any blood when you they see during pregnancy, you need to go see your doctor. Make they
Yeah.
check why you they see that blood because it can be
Mm,
a sign of
yeah,
problem
yeah.
for either
Mm.
you or your baby. So you once you notice bleeding, as far you don't get belle, I beg go hospital, go see your doctor, a gynecologist to be precise.
Okay, thank you, Dr. Israel. It's abnormal. It is not normal. No woman is supposed to see period when she get belle. So don't let anybody tell you say if you get belle and you dey see blood na period because so many women they don't lose their belle like that. So just like Dr. Israel talk about, please run and go to the hospital. We get question on Instagram, Dr. Israel. Horin Khan on Instagram says, Doctor, please, what are the disadvantages of a low PCV blood test in the body?
I not get your question, I beg.
Okay, so let me modify the question. This person on Instagram, they ask us, it be like say he get low PCV. He can't they ask what are the disadvantages of when somebody get low PCV?
Okay, when person get low PCV, one of the things is that he go they weak. Eh? He go open himself for a lot of infection and to the come inside. The body go they hot. Eh? It go lead to heart failure because and now that one we dey call anemic heart failure. It go lead to kidney damage because you not get a lot of blood, the body go try to make sure say some part of the body they get blood past some other part. And one part when they quick comot blood from now the kidney. The kidney, the intestine. So if the kidney not get too many blood, it will lead to kidney failure. It will lead to kidney failure, acute kidney failure. So these are some of the things when fit happen when you not get enough blood for body. So it not be better thing. So once you notice say your blood for body don't dey short, less than 30, you need to try and build them up again. And yes, you need to try and build them up again. Make I not
Yeah,
complicate a lot of things because if I
yeah,
talk too many
yeah,
things now, people go confused. So you need to
yeah.
try to build them up. And there are many ways when you fit take build them up. You fit use your normal diet, stay build them up. You fit get some medications, stay build them up. But before you even need to build them up, you know, hospital now you need to go. Now the doctor go see the level of the blood level how it don't reach, and tell you the way when you go fit take build am up.
Thank you very much. Questions plenty today. Okay, let's try to be fast. Please just advise me on the kind of food I need to be taking. The doctor said I have gastric ulcer. Okay, let me say something. May I add something? When you see a doctor, a medical doctor, and he tell you say you get this medical problem, every time your doctor will tell you what to do, this and that. So when you say you see doctor, the doctor no advise you on the food to eat. If he no advise you, you no ask him, but we will tell you, we will advise you. We don't do video about them. Avoid anything we get like pepper, spices. For some people, it will trigger their heartburn. Avoid fasting, avoid hunger, avoid stress, avoid alcohol, avoid smoking. Avoid all those carbonated drinks, all those drinks where you go drink, you go do ish. Avoid them. Because it gets some people when they get ulcer, whether not gastric ulcer or duodenal ulcer, if you give them heartburn and problem. We will also advise you monitor fruits. You get some fruits where you go chop. These fruits will give you heartburn. Fruits like oranges, watermelon, pineapple, and the rest. Take note of them. If it give you heartburn, avoid them. Also, take note of smoking. You get people where they smoke. This thing too feel worsen their problem. They will come ask us if he heal. Yes, if he healed, if you follow your doctor's advice, you take the medicine, by the grace of God, you will be lucky and it will disappear. Okay, Israel, you get anything to add?
No, I think you don't talk all of them.
Okay. We get plenty questions today. Jesus Christ. Please, doctor, what causes shocking of leg? I mean, if you sit down for a long time or you didn't position your leg well, and if you want to stand up, you will feel as if blood is not flowing there. Okay.
You talk, you give us the question and you also give us the answer. You say you'll be like say blood not there. So that's the main reason. Now because blood fluid and they go up and down for the leg. So once you not sit down well and there's a little maybe a little occlusion, blocking. If you not block and well, but just a little occlusion, if it leads to that. And when you stay in one place for a very long time, because movement they make your blood they go up and down very well. And so once you sit down for a very long time, those blood they go up and down very, very well. So it could lead to those shocking of the leg. So in not be one thing when you need to the fear put. What you need to do is just to stand up and try to move. And if you notice, once you move a little, those things will just stop. So it just your blood flow and they cause them.
Thank you, Dr. Israel. Before we continue, I beg, please remember this program now every Sunday by 8 p.m. Nigerian time. Me and Dr. Israel, we don't do this program for 4 years. Every Sunday, we day here. So I beg, take note of this page. No go follow fake page. May them chop you. You're going to cry. This is the page here. We come here every Sunday. We answer questions. We teach. We get other doctors who they also join us to teach people. So I beg, look at this page. Inform our people. May them not go follow fake page. May them chop them. Thank you. Dr. Israel, how can one boost up sperm count naturally?
Okay, if you want to boost up sperm count naturally, you fruits go help you very well. Exercise go still help you. Now, when we say fruit, which fruit? You talk about banana, we talk about tiger nut, we talk about a watermelon, we talk about yogurt. Not be the sweet yogurt, but I know some people want to go lick the sweet yogurt. No, take your natural yogurt that when not too the sweet. Coconut self still join. I think I've mentioned tiger nut, cucumber self join. So when you take all those fruits, you they do exercise, you run away from stress, you know they wear tight, you know they sit down for men, you know they sit down for where they hot, or wear too much tight fitted something we call they cause heat and heat too much. So with that means you go to boost your sperm count like that. And so those are just a few ways when you put boost your sperm count.
Okay, more questions plenty. My friend catch gonorrhea and his girlfriend no get any sign of gonorrhea. Can a woman have gonorrhea without symptoms? Please, Dr. Israel, before you answer, no vex, I beg. Concerning that low sperm count, in addition to the low sperm count, exercise will help you. Exercise, not endurance exercise. Add exercise, it will also help you increase your testosterone level, and at the same time, it will also help you with production of more sperm themselves, together with what Dr. Israel don't tell you. Dr. Israel, go ahead.
Okay, and yes, women they get. Can a woman have gonorrhea without? Yes, women can get gonorrhea without symptoms. In fact, now man, they quick bring out symptoms when it comes to gonorrhea past women. Women can get them for some time and they not go feel anything, and it go be like say nothing they do them. Whereas once the man gets her immediately, they go start to feel the symptoms. So the answer to your question are yes. It just be like for candidiasis, women they quick get the symptoms past the man. The man fit get them, but he not go quick notice say yes, he get anything like that. So once the man for the gonorrhea, once the man don't the symptom don't they come out for the man body, what you need to do as the man they treat himself, as I first talk for every infection, as the man they treat himself, the partner also need to dey treat themselves as well.
Thank you. I beg, share this live session. Ladies and gentlemen, we might extend today's live session a little bit. I beg, share. This question, is it okay to take ginger, lemon, and clove water daily for cleansing of the system?
Okay, for that your cleansing of the system, I think you have to remove that from it. But taking it as water, yeah, you can take it every day, but it's not because you want to clean system. Yeah, it gets your benefits. Yes, it gets its own benefit, not be for cleansing of system, but it's okay. It's normal. It's good to take. It's good. Normal. It's good to take it, daily if you want to.
It's good, but it should not cleanse anything. It should just help your body. It's not as if you are cleansing anything. Okay, good. Many questions, plenty for here. Okay. Doctor, please, what causes period to come out very little?
Now, when you say period comes out very little, sometimes we dey concerned about the days when they see the period. And so how many days you dey see the period? 9 days very important to us, not be the number, not how the. And sometimes if it too common, if wetin dey come out many well, we fit still dey very concerned. Now if they come out small, not too many, and it has always been like that, you don't really need to worry yourself. You don't really need to worry yourself. So if maybe before you dey see am 3 days and you come dey see am 1 day, that na problem too. So we need to, now that one I would say very, 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 very important to know.
Okay. Doctor, please, consumption of soluble fiber after food to subsidize blood sugar, is it good?
All this many English, so Dr. Fred, answer.
Okay. Now when you say soluble fiber, I don't understand where you get that soluble fiber from, because a lot of people, they come with big terms on the internet because they want to sell one thing or the other for you. If you get high blood sugar, the advice is exercise, cut down on excessive body weight, avoid junk food, avoid processed food, eat healthy, eat protein, reduce your carbohydrate intake, eat fruits. Fruits will not cause you diabetes. Do you understand? These are the things that will help you. But if your blood sugar is above a certain level, you don't do all these things, you might need to be on medication. If you don't get diabetes, your blood sugar is not abnormal, then what we go tell you now, everything where I don't tell you, do all this and then you go do okay. Yes, fiber will help your body and the absorption of glucose. You know, go make the body absorb all the sugar too fast. But these are healthy sugars. These are not artificial sugars. But when you can't mention soluble fiber, I don't know where you get that from and in what context. Do you understand? So please, Juliet, thank you for the stars. God bless you. I beg. The questions are much. Let's see. Doctor, how often should one recheck the hepatitis?
Okay. As I earlier said, if you check your hepatitis, mostly hepatitis B, and it's negative, you go take the vaccine. Once you take the vaccine, you don't really need to check it again because you have taken the vaccine. Now, the only thing when you fit do after you have taken the vaccine, some persons say if you have taken the vaccine, you may want to do the viral load to see if the vaccine when you take, they really active. If they very active. So if you're not there very active, you may want to repeat the dose of the hepatitis B vaccine. So that's the only one. Say, but once you don't take the hepatitis B vaccine, you really don't need to go and check yourself for hepatitis B again. Yeah.
Thank you, Dr. Israel. Let's see. We have a question on okay, no. I beg God. Thank you, doctor. Please, is it true that hot alcohol dry fats in the body?
Which one is cool alcohol?
It's not true.
That
Blessing.
it's not true. It's not true. Now,
Blessing, ma.
alcohol actually does not even dry fat. Alcohol fit even make. That's why we say when people don't do, one of the things that they make people quickly do obese. Now, even the consumption of alcohol, you see that they're going to get big tummy and all that, because those alcohol, when they don't stay for their body for a long time, they will be converted to so many things, and one of it that can be converted to now fats as well. So it does not actually do what you think say they do. The best way to control fat, if you really want control fat, now to watch what you eat and do exercise. So when you do exercise and you watch what you eat, you will control fat. You will control fat. Not be to come dey burn yourself with alcohol, come dey burn yourself with hot alcohol, according to the question.
Okay. Let me see. This person, I'm seeing you for the first time. Doreen on YouTube. All the people watching us on YouTube, thank you. Watching from America, thank you for watching us. Thank you for joining. Please, doctor, what is the cause of tightening in the chest?
Tightening in the chest, many things fit cause am. So somebody that have asthma can have tightness of the chest, cough fit cause am. If you had accident, if you can get some tightness in the chest. So when you notice anything like that, tightness in the chest where you never noticed before, it go good when you go hospital, go see your doctor. So that may not come be like say you don't get problem with your lungs or the rib cage or even your heart, because now then did that environment, or even the esophagus when you see they pass the back, all of them did that environment. So you really need to go see your doctor so that they go do some investigation, some tests for you to know what they cause the tightness, and they will treat you. In fact, when you talk tightness of the chest, they go want to ask you some other questions. How long you don't see how long you don't notice should they cough, if they disturb your breathing, how the tightness they be, just like that, just all those many questions. So they will ask you all those questions before they will know waiting it could be. Yeah.
More questions plenty. Oh, I beg, help us share this live. Share, everybody share. Good evening, doctor. What do it mean for person to get too much vitamin C? Okay, let me answer this question. I know that many people love to take vitamin C. Vitamin C is very good. It is your fruits, it is your supplements. But guess what? It gets some people, they fit go take vitamin C beyond a certain amount. I don't do video about them. And when they take vitamin C beyond a certain amount, it fit increase your risk to get kidney stone. So what we they always advise people, we say, whenever you they take these things like this, like supplements, get somebody where they guide you. That is number one. Number two, if you are taking vitamin C for no reason, give your body a break. You don't take vitamin C for 1 month, for 2 months. I beg, give your body a break. No talk say because I hear that vitamin C is all good, then you they drink them all through, so that you don't put yourself at risk of coming down with kidney stone, because research has shown that you can actually increase your risk. So reduce them. Now that one we they tell people. Okay, doctor, sharply. Can a pregnant woman still see her period? The answer is no. Okay, Dr. Israel, we have a question. Please, how long will I stay after ectopic pregnancy before trying for a baby again?
So ectopic pregnancy, if they do the surgery and you find, because most of the time ectopic pregnancy may not be inside the womb, once you are okay, you are fine, you can try again, there's no problem. Because most of the time they don't enter the womb for ectopic pregnancy. It can just be in the tube, maybe, or even in the abdomen itself. It depends on where the ectopic pregnancy is. So as far as you know, say yes, you are good to go, you don't wear well, you can actually try.
Okay, we did live
So
on YouTube.
most people want to say, sorry, most people want to say 6 months. And most people want to say 6 months, but yeah, you can actually try.
Agatha is asking Dr. Israel, is it possible for a woman to ovulate twice, before and after her period?
No, it's not possible. Ovulation is only once in every cycle. Once in every cycle. The only thing is that you may try to ovulate the first time. It don't work. Then it will come happen again. Now, the first time we call it failed ovulation. Yes, you may have all the signs and symptoms. Say, oh man, now my ovulation, but egg was not released that period. So when you feel them again, now that second feeling, now egg actually release. So now only once in every cycle. Yes, there may be failed ovulation, but now only once now ovulation they take place for every cycle.
Thank you, Dr. Israel. Please, is it good for a PCV blood test to be low in the body? No, it's wrong. It's not good. For your PCV to be low is not good. So Dr. Israel has said it before. If your PCV day low, we need to find out why it day low and then correct them. Because PCV talks about your red blood cell count. Why is it low? Wetin make am low in the first place? Now that thing be the most important thing. When we don't discover wetin happen, we can correct that thing. Like that, then we will come correct the PCV. But not be say your blood go down, you go just go dey drink blood tonic. You have to find out with your doctor, why is my PCV low? Please, what are the signs of prostate cancer? Oh God.
Okay, prostate cancer. Most of the time, prostate cancer they affect old people. So you know the person may be old. Another thing, you go get waist pain. Another thing, you could get signs of restriction, like they feel piss well, or sometimes if you got the piss blood and all that. Then or sometimes some of them they feel their urine. And some of them feel one go piss, the piss no go come out. They'll come they feel like say they'll feel piss small before they go back. Piss don't they worry them again. They'll rush come piss again. And sometimes even when they don't piss, they'll see they feel like say piss inside their belly when they never piss. It piss inside their bladder when they never piss. So when you start to notice all those things, and as I earlier said, they could affect old people. So when you notice those things, you go to think of that. And another thing is that they go they lost weight as well. Sometimes they feel not they eat well again. As they notice those ones, you need to go to the hospital so that they really know whether let me say because you get all those signs and symptoms, you go just assume say prostate cancer I get. No, it's not 100% prostate cancer. It's just that those are signs and symptoms and that follows most of the things where they happen to the prostate. Most of the things where they happen to the prostate. So when you notice those things, go hospital. May therefore know which of them it be.
Okay, Dr. Israel, more questions plenty you, and we don't run out of time. Please, is IVF the only solution for tubal blockage? So somebody had tubes they block. Is IVF the only solution?
If the tube they block, if the two tube they block, IVF is one of the solutions. Another one solution is surrogacy. Another one is surrogacy. Another one is adoption. So you can decide to go and adopt a child. It's also your child. You can decide to do surrogacy. Where surrogacy means say another woman will help you carry the pikin. And the last one, IVF, when we say they go put them for inside your body. So those are the things you can do.
Yeah, thank you. Thank you, Dr. Israel. I will advise you, please speak with a specialist, see a gynecologist to help you. And if they advise you, I beg, follow the advice. We're almost out of time. Is it advisable for someone that wants to get pregnant to avoid sugary drinks or anything that has sugar?
If you avoid that, what you can gain? if you like it, I don't think the thing is that just eat healthy. That's the most important thing. Eat healthy. Why most people they say avoid sugary things is because they fear say maybe this person if you can't get diabetes and all that. Now, diabetes not your they carry the come. Not your they carry the come. Not be the sugar when you eat today will make you get diabetes. Diabetes now something where you don't they do for a long time. So eat healthy and you get pregnant if you are if you want get belle. So far you do the right thing, you get partner, you dey meet the right time, you don't see gynecologist, they don't tell you say everything they good. If everything not today good, they don't already make sure they good for you and all that, so you can get pregnant.
Yes, we go soon round up, but questions still plenty. I beg, no forget this program now every Sunday by 8 p.m. Nigerian time. Every Sunday. If you come late, you go miss a lot. Me and Dr. Israel, we don't day here for 4 years like this every Sunday, and nobody they pay us. We are just here to provide our people with information we go help them. So we go encourage you to join us and help us share these videos. Sandra, good evening. I beg, does stomach ulcer cause serious stomach pain and dysentery and body weakness as though you want to faint? And also sweating, even with taking drugs. What is the solution to asking for an elderly woman in her late 50s?
So for an elderly woman in her late 50 having all these things where they talk, sometimes when we did not when elderly woman they complain of ulcer pain like this, and maybe not the first time they never first get ulcer before, and the very first time they complain of all these things, it may not just be ulcer, it may be something worse than that. So you need to go to the hospital, make they check them very well. Make they check them very well, make they for really know, is this one really ulcer or not something else? Yeah, but if this person don't they get her right from time, they get her, you still need to go to the hospital, because yes, we don't see case when we say, oh, we think say na ulcer because they worry am before, they worry am before. Later in life, we can't notice say na something else, not be just ulcer. So for that person, the best advice now make it go hospital. They can actually have those symptoms when they talk, weakness, stomach pain, sweating, but it good make that person go hospital. Make they check am well to be sure say this thing na ulcer or something different from ulcer, so that they can give the right treatment.
More questions. Doctor, what could be the reason for unexplained infertility, even when both couple are confirmed healthy?
Just as you said, unexplained infertility. So that's something when even the medical world never get answer to. That's why we call it unexplained. So when we see something like that, we know that it's nature that is taking place. And what we tell the couple is to keep on trying. And with time, anything fit happen, they fit can't get belle. Or we give them other means, other way to become pregnant, where IVF is one of it, and all that, and the others is part of it. So, as you said, unexplained is something when even me not go fit explain, because I don't know. So that's just the answer to it.
Yeah, that's why it's called unexplained.
That's why it's called unexplained.
Okay. Doctor, please, is PrEP advisable to be taken even if you are not exposed to HIV?
If you are not exposed to PrEP, is not taken because you are exposed to HIV. PrEP is taken for those that are at risk of exposure. That is PrEP. Yeah, PrEP. That's why it's called pre-exposure. So you have not exposed yourself. You are only at risk of exposing yourself. That's when PrEP is taken. So if you have exposed yourself to HIV, you will not take PrEP again. You will take PEP, when we they call post-exposure prophylaxis. So now two different things. Pre-exposure is before exposure. Post-exposure is after exposure. So for your question, when you say if PrEP should be taken when someone has exposed himself, it's no. You are supposed to take PEP as at that time. So your PrEP is taken before you expose yourself to HIV. So, and it's also good for you to know that it's not everybody that should be taking PrEP. So people, when they take PrEP, I know just okay. If you want really know many things about PrEP, just follow my just follow me to listen to everything about PrEP and even PEP as well. So move for quick comment for you.
Yes, for those who want to know more about PrEP, PEP, HIV, and the rest, follow Dr. Israel on Facebook. We are almost out of time. Oh, good evening, good morning, good afternoon. I have been having heart palpitation, dizziness, weakness, tiredness, and headache. And I have seen a cardiologist over 8 months, and all the medical records showed normal. Please, what do you advise?
What I will advise, I don't know the cardiologist you visited. I don't know if it's a teaching hospital or a private hospital. If it's a private hospital, I will advise you to go to a teaching hospital. And another thing, even though it's a teaching hospital, I will advise you to seek a second opinion. So that because one person may not see everything, or one person may not be seeing anything, another one can say one or two things and tell you what to do. So, and if you notice that you are getting tired and all those things are happening, sometimes you need to rest. And stress can even cause all those many things. And if you are on some medications, there are some medications that can actually cause palpitation, weakness, and all those many things. So if you're on any medications or any medication you are taking for a long time, medications, so they may just be the cause or the reason why you are having those things. And another, as I earlier said, you may need a second opinion. Because when you just list those things, the only thing when you enter my head now cardiologist, until I can't say you'd already visit a cardiologist. So you may need a second opinion, or if you be on any medication, you also need to check those medications very well.
Okay, our time goes soon finish on the program. Let me respond to this. I'm surprised to learn that watermelon is not good for ulcer. Wow. Naomi Edonwoyi, please listen carefully. This is why we come online to answer questions. Nobody said that if you have ulcer, avoid watermelon. What we said is that some people will get ulcer. Some of them go take oranges. They will get heartburn. Another group of people will get ulcer, go take oranges. Then no go get heartburn. Some fit take watermelon and they will get severe abdominal upsets, while some other group of people no go get them. So the advice is take note of all these things. If you get ulcer, take note of all this. If you chop watermelon and it give you heartburn, leave it alone. If you get ulcer and you take oranges, it give you heartburn, avoid it. But nobody is saying that watermelon is bad. If you get ulcer, run away. No, we are not giving you that closed statement. What we are saying is you need to monitor your own body because every individual is different. That is why we don't just come online and say, hey, all of now we get ulcer, or yeah, no chop watermelon. You understand? Even somebody, I get one patient, when he drink Gary, he go get heartburn because he gets ulcer. Are we going to say that Gary is bad? No. But we are taking our time. That is why we come here to break it down and explain to you to avoid confusion. Thank you. Sorry,
wait till me go talk. And Dr. Fred, sorry, wait till me go talk for that issue is that whatever you take, for those who get ulcer, whatever you take when it upsets your stomach, when it make your ulcer worse, stop them. Right. That's just it. So whatever you take and you know say make your ulcer worse, stop and do away with it. That's just the talk.
Thank you so much. Somebody says I want to pay for Telegram. Okay. Let me address this. For those who won't join my private Telegram, for those that want to join my private Telegram, there's a link on this page. Telegram is not for everybody. Now only those who subscribe will join. We get people there. But I noticed that some people they find them difficult to subscribe. I don't know why. Do me a favor. We no get accounts where we they pay into. That is why the link they page. Just see and click subscribe and join. Rashid, sorry, I will advise you try again or use another card to try. But anybody who wants to subscribe and join, look at the link on this page, click on it and try again. We get people there, and those of my people waiting my Telegram. Thank you so much. God bless you. And if you want to join us, look for the link, subscribe and join. It's not for everybody. Dr. Israel, we are out of time. Can we spare more time again?
Okay, no wahala now.
Let's spend like 10 minutes. Please, is it true that excessive reading, like professional exams, can cause mental
mental madness? Okay, I they try not to say anything. Well, we don't see cases say people overread and they started having some mental issues. It not be say everybody where they prepare for exams or when read will get mental issue. If not, so let me say Dr. Fred suppose get mental issue because I know I know how Dr. Fred they read when we did school. And not be me not read. So I know how Dr. Fred they read when we did school. So Dr. Fred Dr. Fred will not get mental issue. So it's not it's not really something that is for everybody. Yeah, there's some people because of stress, it becomes a psychological stress to them. The fear of exam, the fear of make I not fail, the fear of I want to do better because of where they come from. And now they cause those problems for them. So they will want overdo too much of everything. They say is bad. So they want overdo whatever they are doing. So they want to overread. They want to So if you are reading and you not sleep, you not rest, you not eat, you may have issues. And one of the issues that you may have may just be mental issue. I can still remember there was a time I read and not sleep. I was the time when I supposed to sleep. I can't still go use and do tutorials for some people. So I not call sleep. It reached exam day, I could not remember anything I read. I could not even remember what I even taught, what I even do the tutorial for. I don't remember anyone again. Now, with time, when I was able to relax for some time, those things going to come back small. So stress, the reading stress that naturally leads to other things. It's not because you are reading, it's just the stress that follows the reading and the anxiety, all those things. Nothing leads to that mental disorder, not because you prepare for exam.
Thank you, Dr. Israel. Doctor, is it normal to wash the V with warm water due to menstrual cramp?
Due to menstrual cramp? Just wash normal. Wash normal. The most important thing is that during that period, that place might be a little bit have some funny smell and dirt and all that. So just wash, just make sure you are clean, and just make sure you are clean and you'll be fine. Now for menstrual cramp, for some people, there are some exercise you can do and could reduce menstrual cramp. And why some people before the menstruation they can take some medication so that during the time menstrual cramp can reduce. In fact, it's not like that exercise or those things will stop the cramp totally. No, it will not. It will only help to reduce it for those people where they get menstrual cramp during their menstruation. So some exercise there, some medication can be there that you can take during that period.
Okay. For those where they ask us questions, we don't end this program now 1 hour. We no one go beyond our time now just because of few people. Your questions are so much. Let's take 2 more. If it takes a long time for wound to heal and blood sugar is not high, what can be done?
Then you need to know what they make the wound not green heal. Sometimes blood sugar may not be high if you get blood sugar, but sometimes the blood sugar will not high. If it already cause problem before you can't correct and well. So if blood not the flow reach that place where that wound dey, the wound fit not heal. So if who dey dress the wound fit not heal on time. So the better thing, if you get wound like that wey not green heal, go hospital, make they examine the wound, and if they fit even take some sample from there, go do test, and so that make them know wetin make the wound never green heal. So those are the things. And if you dey get sugar, abeg still dey take your sugar medication. It's very important.
Please, instead of taking soft drink, can someone replace it with Zobo drink? Yes, to reduce intake of sugar. Yes, artificial sugars. Yes, your food get the normal sugar where you need. Zobo is good. Let's see. Oh God. Oh my God, the questions are much. Dr. Israel, we need to go because we don't spend more than 1 hour here. Dr. Israel, any final comments?
Okay, and the thing I'll talk now. Thank you everybody for these questions when you ask. For those of you where we not answer your question today, not be our fault. As Dr. Fred said, the question many. So the ones when we feel answer, now we answer for today. Anytime we do as a question and answer session again, and your question come up on time, we will answer your questions. And if you get the opportunity to take follow us on our page, and you see us make videos on anything, because most of your questions we don't make videos on them. So if you follow us, try to go look at our videos, and you can ask questions there. If we come online and we see those questions there, we can address them as we can as at that time. Or those questions will lead to us to make other videos for you to understand very well. We not take you for granted. You guys are wonderful. Thank you for following us. Thank you for joining us every Sunday 8 p.m. and Ask the Doctor. As we don't day here, Dr. Fred always say 4 years. I think it's even more than 4 years. As we don't day here for some years now, and we thank God say we still dey continue. Also, make we try take care of our mental health, because for those of us in Nigeria, even the world is not smiling. We all know that the world is not smiling. Everything they go up every day. So make we try take care of our mental health. No react to somebody talk based on how the person take talk to you, because you never can tell where the person they pass through. So take care of your mental health, so that we all we know we can't shout for road, or some people will can't pull the cloth for road. Thank you.
Thank you so much, Dr. Israel. Thank you, everybody who joined us this night. We are very sorry. Come, the questions plenty, and we are very mindful of your time. We don't want to spend more than 1 hour. We don't spend 1 hour, 8 minutes tonight. So no vex if we no take your questions. If I get chance and I come online during the week, you see me, by the grace of God, I will answer you. No vex, I beg. Mr. Austin, we answered your question. We took time to answer your question, but you just repeat them, and it's not nice. It's not fair if we answer you again, because some people they here, we no answer them. So no vex, I beg. We've answered you. Thank you. Finally, I take on and beg you, be careful. There are fake pages on Facebook that are pretending to be me, but they are not me. So I beg, take note of our pages. Follow us. Help us share our videos, and God bless you. Like I always say, good life now waiting. Good life.
Nonsense.
Good life, Nonsense. Thank you, everybody. Thank you, Nonsense, and have a wonderful night. Bye bye.